All right, well done, Stephen. Our next guest here on the program from Revive Medical Center is Dr. Michael Schulman. We'll call you Dr. Mike and make it easy on us. Welcome to the program. Tell us about your practice. What do you guys do?
Well, thank you, Mike. I'm so happy to be here. I'm very excited. So I run a multidiscipline medical office. So we have medical doctors, chiropractors, nurse practitioners. We do everything from weight loss, stem cell therapy, chiropractic, auto accents. You name it, we pretty much do everything there.
How long you guys have been in business? Brand new company, right? Or brand new practice?
That's right. So I've been in practice
yeah, you've been in practice for a while, though.
Yeah, I've been in practice for almost 10 years now, and I was in Lawrenceville for that long. So I recently branched out and opened up my own clinic right down the road in Lawrenceville, and we've been open for about 2 months now.
And you've got some experts in different fields. You mentioned quite a few right there. So again, talk about, hit some of those things that you guys work with.
Yeah, absolutely. So what I do personally is I'm the chiropractor. So we treat neck pain, back pain, every joint pain in the body. We also focus on a lot of weight loss, which is another thing that I focus on. But what I'm really excited about is our stem cell therapy, which I am completely educated on as far as how to do it, where it comes from. But I actually hire the medical doctors and surgeons to actually perform all the therapies in my office.
Talk about what that is. Some people, we hear about it in the news. A lot of folks don't understand what stem cell therapy is. What is that?
It's one of the most exciting therapies I have. And if you don't hear, if you haven't heard about it now, you're going to hear about it in about a year from now. So pretty much stem cells are called the master cell because when we are born, we're born from one cell, right? So that one cell becomes multiple cells and divides, and they're blank. They don't do anything yet. The DNA in your body tells it what to do. It becomes your hair, becomes your brain, your skin. So we're all formed from stem cells. So stem cells have the amazing ability to grow new tissues as well. And we're just learning about all the possibilities. So pretty much what happens is a patient will come in with arthritis in a knee or torn meniscus. And we could take the stem cells, inject it into the knee, and it will actually regrow new tissues, new meniscus, new cartilage, like it's a brand new knee.
Do the stem cells come from another part of the body?
Yes. So there's many different types of stem cells. So the first one is adult stem cell, which is the most popular. But that doesn't mean it's the best because it also has to do with the age. So if you came to me and you wanted the adult stem cells, we would actually make a hole in your hip, extract your bone marrow, and then spin it down in a special machine extracting the stem cells. Well, based on your age, you may not have high quality stem cells or just not enough stem cells, but we'll inject that into the joint and it will work pretty well. Or we could get it from the best source, which is actually newborn babies. Now, we don't actually get it from the babies, so you don't have to worry about any of that. We actually get it from the placenta or the umbilical cords, which actually has the highest amount of stem cells. And it goes through rigorous testing. The mother donates everything. It has to be a full-term baby. The mother's tested, the baby's tested. It goes through every FDA regulation to make sure it's completely safe to actually transport it into another patient or transplant it. So that's where we typically get it. So if you have a knee problem, I'll simply call it in and they'll send it to me on dry ice. We are guaranteeing 10 million stem cells into your body, wherever you need it, your disc in your neck and your joints in your knees, your shoulders, your hips, wherever you have injury that surgery would typically be indicated, this would prevent you from having surgery.
And you're saying you're getting these stem cells from like the placenta and things like that, that typically would be disposed of anyway.
Yeah, they're thrown away. Yeah.
You said, and you started the interview by saying that if we haven't heard about it, we're going to start hearing about it in a year. Are you guys on the cutting edge of this? Is this something that has just really started to come into to be available?
Right. Well, I could tell you I was probably one of the first doing it with the amniotic tissue in the Atlanta area, even though the adult stem cell has been around for a while. But we're seeing a lot better results with the actual amniotic or stem cell, the umbilical cords.
And I know this is a very brief interview, but it almost sounds like you're kind of saying, hey, whatever your issue is, if you have joints and aches and pains, I mean, this is almost like I don't want to say universal because that might be too big of a word, but it deals with a lot of issues. Almost
every joint and tissue damage in the body. It could grow almost anything. And the research is showing all kinds of new therapies it's working on.
Wow.
We're talking with Dr. Mike with Revive Medical Center. One of your other areas of expertise for you personally is weight loss, you talked about.
Absolutely.
lot of choices out there when it comes to weight loss, a lot of medical practices that say they do that. What makes you guys different?
Well, we offer medical weight loss with HCG, which is human chorionic gonadotropin, which is found in pretty much everybody. So what the HCG actually does is it actually tricks your body to leaving the muscle alone and actually targeting the fat cells. So you'll lose it a lot quicker. So on average, my patient will lose anywhere from half a pound to a pound per day. So on average, about 30 pounds in 30 days. The other thing that makes us different is we're not like a traditional medical weight loss center, because they'll just give you B12 injections, maybe some appetite suppressants, and a diet plan. We go beyond that with the HCG. And then we go a step further with hormone testing. So I'll tell my patients there's always two reasons why you won't keep the weight off or lose the weight. The first one, it's you. You just don't follow my recommendations. Or it's your hormones that are just not functioning properly. So I'll go above, beyond, check thyroid disorders, way beyond what a medical doctor will check. I'll check your adrenal glands, cortisol levels. I'll see if you have any kind of food sensitivities to make sure we're giving you the right foods, digestive disorders, heavy metal toxins, and all that has a factor in if you're going to lose weight or if you're going to keep it off.
Is there a physical plan where there's a workout involved, or are you injecting something, or what does this look like?
So there are no workouts on my plan. So it's a simple injection that you would do every morning, and then you follow my meal plan. There is some light cardio that you could be doing, but we recommend no exercise for the first month because it's a lower calorie diet, anywhere between 500 to 800 calories. It seems like a little bit, but it's really a lot of food, believe it or not. And as long as you time it throughout the day properly. And then we'll do a series of testing to make sure you don't have any of these hormone problems, and we monitor you once a week, every other week, to see how well you're doing, and I'm coaching you through the way to make sure it's working for you. So everybody's a little different.
Health insurance is a huge topic right now, and depending on when people are listening, it probably still will be years from now, right? What of your services are covered by insurance and what are not, I guess would be a good question.
That's an awesome question, because that's what everybody asks. Right. What's covered, what's not covered?
First thing they do when they walk in the door.
So the first thing about insurance companies, they're going to cover you if you're sick, if there's some medical condition that's causing you not to live anymore, right? So a lot of the things I do, such as the stem cell therapy or the weight loss, that's not always going to be covered by your insurance. Now, I do have allergy testing, like seasonal allergy testing, that's covered. I do have Botox for migraines. So if you're suffering with migraines, Botox has been known as the only FDA approved to prevent migraines for up to 6 months, and insurance is covering that. They still are covering some of your traditional medical treatments, and that's about it in my office.
So then I think the follow-up question to that is, and you don't, I mean, it's hard for you to give, okay, this costs this costs this, this costs this. So if a lot of what you are doing is kind of preventative or improving your health, really it becomes a question of you're very willing to work with people on whatever budget you can help them with, because you guys are there to help people who are not sick, but help them feel even better and improve their health, correct?
Absolutely. Yeah, we do all types of payment plans, care credit. We do in-house financing. So, yes, we make it very affordable for everybody.
Because I think in the world we currently live in, and I don't know what it's going to look like as insurance continues to be this hot topic, but I think some people make the mistake of, oh, you don't cover it in insurance, and I'm not going to come in.
Right.
No. If this is something you want and something that would help you think would help you, and getting your opinion on it, I mean, then work out a way to pay it, because a lot of times it's a lot less than what their stuff being covered under insurance, quote unquote, costs.
Absolutely. If you just wait too long, eventually you'll need that surgery, or you won't be able to be helped as easily as you can now. So if this is something you want, we'll make it happen.
I think you might have gotten some people's attention, Dr. Mike, when you mentioned migraines. I have a lot of friends that suffer from migraines.
Yes.
You mentioned Botox is one way to actually, would it be injected? Would it be taken orally? I mean,
yeah. It's Botox, just like a traditional Botox for wrinkles. We'll do it in the face and in the back of the head. It takes about 15 minutes. There's literally no pain, and you go right back to work after, and it could last 6 months, and it will actually prevent migraines for up to 6 months. So that means no more medication, and it's one of the biggest things. You'll even see it on the commercials nowadays for the migraines.
All right. So we've talked about migraines. We've talked about weight loss. We've talked about
stem cells,
joints, And then at the very beginning, you went through a whole list. So I'm gonna slow it down, and I'm gonna say, so those are the things we've kind of concentrated on. So what are some of the other key areas that you see that our listeners need to take out a pen and write down, other than what we've covered, because I'm sure they've written those things down. So what are some of the other things that you guys can help with that you want to make sure and focus on real quick here before we wrap up?
Well, we definitely treat auto accidents as well as work injuries, workman comp injuries. So Gwinnett is one of the largest areas where there are car accidents. So if you have been involved in a car accident, you may not feel the pain right away. It could take up to 2 weeks before you even notice anything. Go see a doctor. Go see someone who's specialized in auto accidents, not just a regular doctor who doesn't do auto accidents, because there is a process. And I always recommend getting an attorney, because if you don't know the laws, well, guess what? The insurance companies do, and they'll try to take advantage of you. So I work with all the best attorneys in Atlanta, and we'll make sure we'll find one for you if you don't know who to choose. But it's one of the things I highly recommend, and see a doctor who's specifically trained in it.
Then you also mentioned hair loss, weak bladder,
Yep,
male enhancement. And you've got experts on staff for all of this stuff.
Yes, that's typically with that platelet rich plasma therapy, which has probably been known in the sports world for a while. And it's traditionally been used for joint pain, muscle disorders. But now it's moving into a more of aesthetic world, where if you've having thinning hair, we could actually inject it into the hair. And then we use a special device called a microneedling device to actually get it really into those roots of the hair to actually help thicken the hair. We actually use it for the face, kind of like Kim Kardashian has been all over Twitter talking about, where you could actually put the platelet-rich plasma right into your face, will actually tighten up the skin, just like a botox kind of treatment. And it's all natural because it's using your own blood for this treatment.
So Kim Kardashian said, go see Dr. Mike at Revive Medical Center? Wow. Man, I'm
I
impressed.
did not say that.
Okay. I did.
Where are you guys located?
We're right off of Old Norcross Road in Lawrenceville, right by the Gwinnett Daily Post.
Okay. And so anybody, how do you find most of your patients? Or how do they find you, I guess?
Mostly Facebook, or just organic searching on the internet. If you put in chiropractor, weight loss, and then we're about to rebrand our entire company. So you'll be able to find us under revivemedicalcenter.com. But right now we're under the apexintegratedmedical.com, and you'll be able to find us from there. Or just go to Facebook and go under Revive Medical Center or Dr. Michael Schulman. You'll definitely be able to find me.
I guess I would recommend, Stephen, if you're interested in any of this, whether it be weight loss, hair replacement, some of the other things that Dr. Mike talked about, to go do your research and then have a conversation with Dr. Mike and some of the folks on his staff.
Yes.
That'd be a good place to start.
I know. Yes. Why are you looking so directly at me when you mention weight loss and hair loss?
I'm just talking to you,
Mike.
Stephen.
Yeah.
Just talking to you.
Okay. Yes. We're doing a wrap up. It's my self-conscious.
You're not first, you're last.
I'm being self-conscious about it. I apologize.
Yeah. Go ahead and give the website again.
It's going to be apexintegratedmedical.com.
As of today, we'll do the show for now.
Or you can find me on Facebook at Revive Medical Center.
And is it okay? I mean, is there a phone number for the center? Give that out. Yeah.
We need that. 770-545-8888.
Dr. Michael Schulman with Revive Medical Center. Thanks so much for coming on the show.
Thank you.
All right. Did you get the phone number, Stephen?
I did. I wrote it down.
You wrote
Absolutely.
Yes. Good to be checking it all out. All right. I want to thank Dr. Michael Schulman with Revive Medical Center for joining us here on the show. Also, Jeff Lale with Motorsports Worldwide Management Group. Just think, you could drive. You could have we could have a full head of hair. Drive our car really fast. The wind blowing through our hair. How cool would that be?
I'm sorry, but every time I get out of the shower, I just enjoy that I just towel off and go. Sorry.
There are some benefits, right?
There's definitely benefits.
Absolutely.
If you don't think bald is beautiful, then you definitely, or if you have any kind of joint pain or any of the other things he talked about, you definitely can go talk to Dr. Mike.
Absolutely. All right. Thank you to our guests. Thank you to our listeners. Thanks to Trey, of course, for producing the program. A reminder, you can listen to the show anytime, 24/7 by going to GwinnettBusinessRadioX.com. You can listen to any of our shows for all our episodes. We've been doing this now, 4.5 years? It's a lot of shows.
It's a lot of shows.
It's a lot of shows and a lot of put downs for each of us.
That's right.
Going back at each other.
That there's rubbing, son.
Yeah.
And rubbing is
first
racing.
you last. All right. And as always, as we just say goodbyes, Trey wants to remind you that
To be the man, you gotta beat the man. Woo!